The CDC released a new warning today for doctors and parents about a rare condition that's making some kids really sick. Our 9 health expert, Dr. Pyle Coley, joining us now. And this is unusual, but apparently some kids are getting severe hepatitis. What's making this severe? And then what should we as parents be looking out for?
So hepatitis is an inflammation of the liver, and it's essentially the body's immune system attacking the liver. Can be caused by viruses, but the liver, as you know, is an organ that sort of filters your blood, processes your nutrients. It's part of our GI tract. So symptoms of early hepatitis are like abdominal pain, nausea, vomiting, diarrhea. But as it gets more advanced and the liver's function starts to shut down, you can start to see jaundice or yellowing of the skin occur. So that's really what parents should be watching out for. Kids often have belly aches and things like that, but if it's something that's a little more severe or your child's not eating normally, not acting right, that's when you start thinking hepatitis.
This has turned out kind of severe in some cases. You're even talking transplants, but do we know, like, how did this get going? I mean, I can't remember ever hearing this before.
Very concerning, and it does appear to be a pattern because we're seeing it abroad in the UK, we're seeing it here in the US. The most common cause of hepatitis is usually viruses that cause hepatitis. Hep A, Hep B, Hep C. Hepatitis can also be caused by foodborne illness, though. So if you eat some contaminated food. Now, in these sets of kids, they didn't find any common link. They're kids aged 1 through 6, all previously healthy, no real exposures that overlap. The only thing they found so far that seems to have overlapped is adenovirus, which is usually a virus that causes a cold. Very rarely does it cause hepatitis, except in kids that don't have much of an immune system. So they think that that may be involved.
Wow. It's just unusual, but good to know the signs to look out for.
Well, and parents should, if they've had a child with hepatitis, report it to the CDC. So that's the take-home message from this. If your child has had any kind of inflammation in the liver or you're not sure, check with your doctor and report it to the CDC.
Good advice. We want to switch gears just a little bit because the CDC just came out with a report about the most common causes of death for kids. Now includes gun violence, drug-related deaths. That is hard to say, let alone know that it's true. Does that surprise you?
You know, it broke my heart. It doesn't surprise me because of what we've been seeing in the office, but it really broke my heart to see this because we've been doing such a great job vaccinating our kids, you know, preventing infectious disease, preventing cancers, and now we have this new preventable causes of death like gun-related violence and drugs. So I really think it's a wake-up call for us, and it's for the first time ever that we have had more kids die from gun violence than from motor vehicle accidents. So we need to wake up and do something different as parents and as healthcare providers.
Now.
So gun locks, I mean, what else? What are your suggestions? And doctors too. I mean, we got to reverse these trends.
You know, 1 out of 3 Americans owns a gun. And so either you do or you know somebody who do, or a child may be exposed to somebody
or goes
who does.
to a home.
Yes, a friend's house or something. So I think the most important message for parents here, talk to your kids and talk to them early. Now that may sound counterintuitive. You're not putting the idea in their head, but they're saying as young as toddlers, as soon as they start to sort of express an interest in guns or talk about guns, you want to broach the topic of gun safety. Of course, when they become older, adolescents and teenagers and young adults, then you want to talk to them on a more serious level about access, about what their thoughts are about guns, what their friends are doing with guns. And similarly with drugs, you want to talk to them early at the first suggestion that they may have been exposed to drugs, because education is a big piece. Leverage your doctor. And something I wish I did in more of my visits is talk to my patients about whether they are educated about owning a gun and whether they're talking to their kids about it.
Yeah, it's interesting because even, you know, my daughter's 2, but the pediatrician, every time we go, is there a gun in the house? Is there smoking in the house? And I'm like, wow, questions I'm not thinking I'm going to be asked when I go to the doctor. But, you know, to your point, that it's something you should be talking about with medical providers as well.
And I think now even talking about drugs, you know, we tiptoe around drugs because we're embarrassed or, you know, we don't want to put the idea in our kids' head. But I think bringing it up and saying, has anyone offered you drugs? Or have you ever thought about taking a drug? Really, really important.
Do you know someone experimenting? Yeah. Oh, all good stuff. Dr. Coley, thank you.